right. Absolutely. Hello, thanks for joining. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We're here to give a weekly COVID-19 update with a particular focus on youth. I'm happy to be joined by a number of folks. Pedro Martinez, the CEO from Chicago Public Schools, Dr. Geraldine Luna, Medical Director at Chicago Department of Public Health, Dr. Maya Green, the Chief Medical Officer at Howard Brown Health, Dr. Juanita Mora from the Chicago Allergy Center, and Dr. Horace Smith from Ann and Robert H. Lurie Children's Hospital of Chicago. He is also a board member on the Board of Health for Chicago. So, update. Travel advisory. We now have 38 states and 1 territory on the travel advisory. As of today, Alabama, Mississippi, and Tennessee have all improved enough to be removed from the travel advisory. Arkansas is back on. I want to remind people that this travel advisory applies to people who are unvaccinated. So another important reason to be getting kids vaccinated, family vaccinated ahead of the end of the year holidays is that then a lot of schools do use the travel advisory related to return to school. And so we want to make sure kids are getting vaccinated related to travel. If we look in a little more detail at what's happening across the country, really, the upper Midwest is driving a lot of the COVID outbreak right now in Chicago. The national average is 26 COVID cases per 100,000 population. Chicago is currently at 16, so we remain under the national average, but certainly increasing. There have been more than 47 million Americans diagnosed with COVID and more than 760,000 deaths. To put a little finer point on the Midwest data, right now in green here, the Midwest is seeing the highest average daily COVID case rate in the U.S. All Midwest states continue to increase, including Illinois. And Michigan and Minnesota right now have the highest COVID case rates per population in the country. You see that black dotted line there is Michigan. Both Michigan and Minnesota right now averaging more than 70 cases per 100,000 per day. Really in the middle of a big spike, very much being driven by unvaccinated people. And if we look at the national data on this, this shows you the average daily cases in the U.S. on the left and the average daily deaths on the right. And on the top, we see what that looks like among unvaccinated Americans and on the bottom among vaccinated. So across the whole U.S., although the numbers are flattening out, we continue to see 6 times the rate of cases in unvaccinated Americans versus fully vaccinated Americans. And for deaths, we continue to see 12 times the deaths for unvaccinated Americans versus fully vaccinated. I usually talk about the Chicago numbers, but I wanted to put this in the national perspective as well. When we turn to Chicago, we remain at a high risk for community transmission because we are averaging 445 cases per day being diagnosed in Chicago. And that puts us in the high transmission risk. It is up 10% from a week ago, despite the fact that testing is down 5%. So this is not just a testing artifact. It is a true increase in cases. Similarly, our percent positivity as of today is at 2.5%. Still in the lower transmission risk. We're well under 5% because we're doing a lot of testing, but it is up from 2% just a week ago. Our hospital numbers are on the increase. We're averaging 235 Chicagoans hospitalized with COVID right now, and we're getting up toward the substantial risk there. It's been increasing every day. ICU numbers are holding relatively stable, just 60 people in the ICU with COVID across Chicago, and that's really reflective of the fact that a lot of the highest risk people, the people who are oldest, have the underlying conditions, are largely vaccinated. And so it's been good to see those ICU numbers stay relatively stable. Where we look at this graphically, at 445 cases per day, you see there has been an increase. It's nothing like what we were seeing last fall, thank goodness, but definitely back on the up as we're moving into the winter season. And similarly, you can see positivity, that's the whole outbreak over time, 2.5%, quite good compared to where we've been overall, but heading the wrong direction. I want to really highlight some changes that we've seen in the last few weeks, particularly related to children. As more and more adults have the opportunity to and are vaccinated, we are seeing children be more likely to be diagnosed with COVID. It doesn't mean that the schools are any less safe. It doesn't mean that the risk has changed, except that as community numbers go up for COVID, we see those same numbers go up in every setting. So for example, at Chicago Public Schools, we've seen about a 30% increase in COVID cases since late October. What has the percentage been in cases overall in the city of Chicago? 30%. That really is what drives it. But as of today, the highest case rate in Chicago is actually in unvaccinated 12 to 17-year-olds. This is new. We were not seeing a lot of children, being at the highest risk. But at this point, on the left side, we have unvaccinated broken down by age, and then on the right, fully vaccinated. And it really is these unvaccinated teenagers that are right now a big part of what's driving this increase, and remains a real focus for the department and for all of the schools in Chicago. In the last 30 days, 1 in 4 Chicago COVID cases have been in children under age 18, whereas over the whole pandemic, it's been about half that, 1 in 8. Some of this is because there's more testing happening, of course, in schools that we've talked about, but this is also just a reflection that many children are only now getting the opportunity to be vaccinated. So I want to highlight, again, where we're only looking at teenagers, just here in Chicago, the risk of being diagnosed with COVID in Chicago for 12 to 14-year-olds is 10 times as high for unvaccinated 12 to 14-year-olds as it is fully vaccinated. And for 15 to 17-year-olds, 7 times as high. Those numbers, those solid lines on the top show you what's happening with the rates among unvaccinated teenagers, whereas those numbers on the bottom, we're seeing very few breakthrough or issues in vaccinated teenagers, but really putting a lot of emphasis there. 2/3 of Chicago teenagers have had their first dose of vaccine, but we still have a long way to go. I also just wanted to highlight that where we are seeing some of this increase in COVID infections, it's actually among people over 65. If you look at that graph there, the yellow shows the big increase in those over 65. And there too, the biggest risk factor are where people are still not vaccinated. On the left side, that gray line shows you the hospitalization risk among unvaccinated people over 60. Breakthrough hospitalizations are very rare, but where we do see them, it tends to be in people over 60, which is why we've been really promoting boosters, especially for people who are older and have underlying conditions. Similarly, where we look at the death rates right now from COVID, breakthrough deaths are very rare on the right there. 99.99% of the time, we don't see any breakthrough deaths. But on the left, in gray there, those are our oldest over 60 Chicagoans. And where we still have older, unvaccinated Chicagoans, the risk is very, very high and getting higher for those severe outcomes. And where we look at booster doses, Chicago actually is a little bit ahead of the U.S. in terms of booster uptake. So if you look at the whole population, about 15% over 18 have had a first dose of booster, about 23% over 50, and about 34% over 65 here in Chicago. But remember, everybody over 65 who's 6 months post Moderna or Pfizer should be getting a booster dose, and anybody who's 2 months post J&J should be getting a booster dose. So although we're a little ahead of the U.S., we're not where I want us to be still, particularly heading into some of these holiday gatherings. Vaccines continue to work beautifully. Still, 98.9% of fully vaccinated Chicagoans have not tested positive for COVID-19 after being vaccinated. More than 99.9% have not been hospitalized, and more than 99.99% have not died due to COVID-19 after being vaccinated. Where we do see breakthrough infections again, it tends to be for those hospitalized, the median age is 67, and for those who die, the median age is 77. And nearly half of those folks are immunocompromised, with the major diagnosis being active cancer treatment. So another reason we really promote vaccination for everybody is that in people who are older, who have immunocompromised, they do remain at significant risk for COVID outcomes. All right, we'll finish off with where we are on vaccine milestones and a focus on youth, and then we'll bring up the providers and CEO Martinez. We've hit an exciting new vaccine milestone in Chicago. We have passed more than 3.5 million safe, effective, and free COVID vaccinations that have been administered to Chicago residents. How many deaths have there been as a result of COVID vaccination in the city of Chicago? 0. Last Friday, as you will recall, was our Vaccination Awareness Day. Protect Your Health on the 12th. It went beautifully. We broke a 6-month vaccination record for Chicago. You can see that red arrow is pointing to the 12th, and more than 20,000 vaccinations were done across the city, the most that we had done since May 15th. Really, really pleased to see that day be such a success, and thanks to CPS, and thanks to the city, and thanks to employers, all of whom gave folks time off to make sure we could get that done. Not only did we break a record for all vaccinations, where we look at youth vaccinations, we had more than 8,300 first doses of COVID vaccine on the 12th. That was our single largest day for youth vaccination to date. The highest day that we'd had right at the beginning when the teenagers were eligible was about 5,000. So we broke that record as well. And although most of the doses were in 5 to 11-year-olds, we also did the largest number of first doses for 12 to 17-year-olds for any day since August 6th. So really, really successful in terms of getting folks out. And thank you to everybody who made the effort over late last week and over the weekend to get kids vaccinated. In addition to having high numbers of vaccine, we were also really pleased to see how steep that increase has been. We right now are averaging 3,222 first doses of 5 to 11-year-old vaccine every day in Chicago. That actually exceeds the rate of early vaccine uptake that we saw in other age groups. You can see back in that May, June, that big spike in the blue, that was the teenagers, and this is actually exceeding that. So we've now got more than 127,000 vaccine doses for that pediatric 5 to 11 available at about 200 sites across Chicago. It remains available, and I've been very pleased with the early uptake. One other important thing with the focus on late last week was we saw some large and really much needed vaccination increases for our youngest 5 to 11-year-old Black and Latinx Chicagoans. So when vaccine kicked off, we saw more white Chicagoans getting their children vaccinated first. This is a pattern that we have seen in older age groups. And so what this graph is showing is the comparison. The lighter bars are the number of 5 to 11-year-olds by race ethnicity that were vaccinated before last Thursday to Saturday, and then the dark blue is just last Thursday to Saturday. And so you can see, for example, before last Thursday, there had been more than 6,000 white Chicagoans 5 to 11 who had had that first dose, and fewer than 1,000 Black non-Latinx Chicagoans of that age group that had had the first dose, and between 2,000 and 3,000 Latinx Chicagoans. However, with this big push, and as you'll recall, we worked to really prioritize vaccine availability and walk-ins across the South Side, and continue to keep this focus on equity. We're really pleased to see some improvement here. More than twice as many Latinx and Black non-Latinx 5 to 11-year-olds were vaccinated just last Thursday to Saturday, as had been done in the whole first 8 days of eligibility combined. And so you can see, for example, went from fewer than 1,000 young Black Chicagoans who had gotten the vaccine in the first 8 days to over 2,500 just in those 3-day period, and we still have some doses coming in. So very pleased by that progress, but we really need to see it. The biggest predictor of whether or not a child is vaccinated is whether their parent or guardian is vaccinated. And those disparities that we continue to see in race ethnicity for adults are holding true, and that's really what we're working on. Where you look at all Chicagoans of all ages, 51% of Black Chicagoans have had at least a first dose of vaccine. 61% of Latinx Chicagoans, 68% of white Chicagoans, and 72% of Asian Chicagoans. So we still have a ways to go. And unfortunately, that is why the majority of the people currently being hospitalized and dying from COVID-19 are Black Chicagoans. I want to highlight, this graph shows really, with this big push last week, some of that improvement. The colors here are all ages, people who were getting first vaccine doses. And you see, this is over the last month or so, and things had been relatively flat. And then we saw good upticks, and in fact, the biggest increase in Latinx Chicagoans, a 210% increase in first doses compared to the prior week. 112% increase in Black Chicagoans, 145% in Asian Chicagoans, and a 96% increase in white Chicagoans. That's what we want to see. There is still ground to make up there. You can go to our dashboard now if you want to see what's happening with those over 5. We're tracking citywide, community-wide, 5+ vaccination rates, and you're welcome to explore that more. We will be updating that every day. And so as a city overall, if we focus just on the 12+, who of course have had the availability for some time to get vaccine, we're at 76.3% of all of Chicago has had a first dose. And those darkest blue communities are the ones where we've hit at least the 77% goal. Where we look at the completed vaccine series, the darkest blue, you can see there's still not that many communities, but especially really big shout out to the Southwest there, have hit the 77% mark, and overall the city is at 69.8%. So just to finish off, I want to remind you that beyond protecting your child's health, your family's health, and getting Chicago past COVID, there are 2 really practical reasons why we'd love you to get your kids vaccinated right now. Not in a month, not in 2 months. Number 1, children and adults who are fully vaccinated do not need to quarantine after a COVID exposure unless they develop symptoms, et cetera. So especially where we think about school disruptions and parents having to take off work, you getting your children vaccinated is the number 1 thing that you can do to help not disrupt their education. And then number 2, like I started with, children and adults who are fully vaccinated 2 weeks post that second dose can travel without any restrictions. So these are 2 other reasons, obviously beyond health. And getting vaccinated right now is what we need in time for the holidays. So pleased with that work late last week and over the weekend. Even 1 dose before Thanksgiving starts to build protection. And children need to get a first vaccine dose by this Saturday to be fully vaccinated by Christmas. Adults too. So now really is that moment. Sunday would be the first dose for Pfizer to be vaccinated in time for Kwanzaa, and as you know, we're going to continue to really focus on these dates ahead. But now is the time as the holidays are surging. I want to highlight that we are breaking records all over the city. Obviously, the employee a lot of focus on getting City of Chicago employees done. We had more than 500 vaccinations for City of Chicago employees at City Hall here just last week, the most we'd ever seen. Our public CDPH and city colleges last weekend did more than 730 vaccinations. Those are open to the public. This Saturday, we're at Kennedy King. This Sunday, we're at Olive Harvey. There is vaccine availability. We also are putting some extra focus on some of the departments that are lagging a little bit in vaccination rates. So, for example, today, there is a clinic available at Chicago Police Department headquarters. There's 2 more of those scheduled. We've been sending out vaccine ambassadors, doing a lot of education, really working to make sure that City of Chicago employees are also being prioritized in getting the education. And as a last reminder, where do you find a vaccine? Always chai.gov/COVIDVax, and always you can call our number, 312-746-4835. We'll find you a booster, we'll find you a first dose, a second dose, we'll figure out whatever question you have, we'll set you up with an at-home appointment. Pharmacies continue to be the #1 place by numbers where people are getting vaccinated, including 5 to 11-year-olds, and Walgreens is expanding its 5 to 11-year-old accessibility there. But there are lots and lots of opportunities, including in the community and at schools. And with that, I'm very pleased to hand it over to CEO of the Chicago Public Schools, Pedro Martinez. Thanks.
Thank you, Dr. Arwady. So let me show you some of the numbers that we're seeing for CPS students. Oops, go back, there you go. So you can see the totals here. So first of all, we're very excited that on the 12th, we had almost 6,700 students vaccinated. Of those, just over 5,800 were 5 to 11-year-olds. When you count Thursday through Saturday, it was close to 13,000 CPS students got vaccinated, and of those, 11,434 were 5 to 11-year-olds. So for us, this is the beginning. So I'm very pleased that we had strong numbers. And so now going forward, really our strategy, we're going to have over 133 vaccination events throughout the months of November and December. But now we're going to be very targeted. So we're going to be working now with our principals, our teachers, and really helping to just trying to understand what are the concerns that parents have right now, and bringing regional providers. So for example, last week we partnered with St. Anthony's, who came to the Little Village community and was at one of our schools. So we have several regional providers that are trusted in those communities. And so we knew there was going to be a first set of families that, given the opportunity, they would be able to take advantage of this. But now going forward, we want to be very strategic. And this is the beginning. We've always said, really last weekend, Friday specifically, was the beginning of this big effort, but now we can be much more targeted, and we will also leverage our resources so that for families who now have their first shot, if they need help with the second shot, we will also provide that support. I've gotten questions before, are we planning to cancel classes for the second shot? We are not, but what I want to know is which families, especially as we get the data by school, which families may need help, because we have mobile clinics. Of course, we have we have over 16 school-based clinics. We have our 4 regional centers. But like I said, we're going to have 133 vaccination events just in the months of November and December. And I can't emphasize enough what Dr. Arwady said. If our children are vaccinated, we don't have to quarantine. We are seeing cases starting to rise. By the way, for us at CPS, we saw just over 250 cases last week. That's for the full week. But again, so we saw an uptick from about 160 the week before. So we're still very low. But of course, my concern is that we have the holidays coming, we have the winter coming, and so I want to make sure that we're very that we know that there's risks that are coming. So again, I continue to urge our families, please get your children vaccinated. Make sure I didn't miss anything. And we are going all out in terms of communicating to our families. So again, we're going to work with our schools so that we'll be sending communication to our families, on a weekly basis about both information about vaccination events and also just offering any kind of assistance we can provide around providing information. Tuvimos mucho éxito este fin de semana. Podemos ver que tuvimos más de casi 13,000 niños que tuvieron sus vacunas por la primera vez del jueves al sábado. Más de 11,400 eran niños de 5 a 11 años. De nuestras escuelas, y también tuvimos el viernes, ese día nomás tuvimos más de 6,600 niños y 5,849 niños de 5 a 11 años. Así que quiero decirle gracias a todos los padres que tomaron ese tiempo para llevar a sus niños para recibir su vacuna. Si necesitan ayuda con la segunda vacuna, vamos a trabajar con ustedes, con los directores, con los maestros, para darles información, porque tenemos programas móvil donde podemos ir a las escuelas para ayudarles, pero también para las familias que no tomaron esa oportunidad. Por favor, queremos ayudarles, queremos informarlos para que reciban información. Vamos a trabajar con muchos médicos en las comunidades para ayudarles con esa ayuda. So again, for our families who didn't take advantage of this weekend, we're going to be reaching out. We're going to be partnering with our regional providers. We will have our own resources, and this is the beginning. So we're going to be doing this to the end of the year. Este esfuerzo va a estar todo el año, porque nosotros sabemos que ahorita COVID todavía está con nosotros, los casos están subiendo. Ahorita es el tiempo para proteger a nuestros niños. With that, I'll bring Dr. Luna.
Thank you. Gracias, CEO Martinez, Dr. Arwady. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago, y hoy les vamos a dar actualizaciones de lo que está ocurriendo con las vacunas y el COVID-19 en nuestra ciudad. Hoy es un día muy importante. Estamos aquí para discutir la necesidad de vacunar a nuestras comunidades de color. Con la reciente aprobación de las vacunas de niños de 5 a 11 años, es esencial aprovechar esta oportunidad en nuestras comunidades latinas para proteger a nuestros niños. Antes de entrar en más detalles, quería actualizar rápidamente sobre el aviso de viaje. Alabama, Mississippi y Tennessee han sido eliminados de la lista de aviso para el viajero, mientras que Arkansas se ha agregado nuevamente a la lista. Eso deja 38 estados y un territorio en la lista si planea viajar. Y si planea viajar, recuerde, la manera más segura es vacunado, completamente vacunado, para que no tenga que hacer cuarentena para entrar nuevamente a Chicago, ni pruebas de COVID negativa antes de salir y al entrar. Los casos continúan aumentando en nuestra ciudad. Al día de hoy estamos promediando 445 casos diarios, lo que nos pone en alto riesgo por las definiciones del CDC. 14 hospitalizaciones y 3 muertes con una tasa de positividad de 2.5. Es más importante que nunca vacunarnos. Pendiente que sabemos que todo el año pasado también tuvimos un repunte para esta misma fecha. Así que podemos cambiar esta curva de casos. Y lo más importante que 98%, 97%, 98% de estos casos continúa siendo en personas no vacunadas. Se ha convertido en la pandemia de los no vacunados. 71% de los habitantes de Chicago de 5 a 11 años han recibido la primera dosis de la vacuna. Esto es un gran motivo de celebración, especialmente cuando vimos esa primera semana anterior. De ese grupo etario que ha recibido la vacuna, tenemos a 33% siendo en caucásicos, 33% en latinos, 19% en afroamericanos. Vemos que la captación y la aceptación de la vacuna fue increíble durante la semana pasada y el fin de semana, con más de 210% de incremento en la utilización, en la aceptación de la vacuna en latinos. Así que felicidades a sus padres que se tomaron el tiempo en proteger a sus familias vacunando a sus niños. Pero todavía tenemos camino que recorrer. Sabemos que el mayor predictor de un niño, que si un niño será vacunado o no, es si los padres de esos niños están vacunados. Esta es un énfasis, una iniciativa en familia. Es la manera más segura de protegernos a nosotros, nuestras familias y nuestras comunidades. Las vacunas son seguras y eficaces para los niños. Se ha probado. Estamos más preocupados por el impacto de contraer COVID-19, ya que el contagio mayor de casos en Chicago están ocurriendo en niños de 12 a 17. Óiganme bien, esta es la primera vez en la historia del COVID-19 que vemos que nuestros niños están liderando los casos de COVID. Nuestros niños de 12 a 17 años están en riesgo. Así que si no han vacunado a sus niños, por favor háganlo. Si no han vacunado a su familia, este es el momento. El CDPH o el Departamento de Salud ofrece muchos programas y formas distintas de vacunar a nuestros niños. A partir de ayer, el programa de vacunación al hogar Protect Chicago at Home también ofrecerá vacunación pediátrica para todos esos niños de 5 a 11 años. Puede ser una cita llamando al 312-746-4835 o hacer su cita en la página web conchicago.gov/at home. Y van a llegar y pueden vacunar hasta 10 personas con incentivos de $100 por vacunación, 50 por cada serie de Pfizer y 100 en el momento si recibe una vacuna de Johnson & Johnson. Los eventos comunitarios patrocinados por el Departamento de Salud Pública también han comenzado a dar las vacunas pediátricas. Puede ir y ver el calendario comunitario para saber qué evento está ocurriendo en su comunidad. Así que visite chicago.gov// Vax Calendar, o puede llamar también a nuestra línea de apoyo para saber obtener información de dónde vacunar a su familia y a sus niños. Todos los niños de 5 a 11 años, así como cualquier persona de 12 años en adelante que reciba su vacunación primaria o parte de su serie primaria, recibirán estos incentivos de $100, 50 por cada serie o 100 por Johnson & Johnson en el momento. También estarán disponibles en las clínicas del Departamento de Instrucción o CPS. En la mayoría de los lugares de vacunación, los padres deberán acompañar a sus niños. Las excepciones son las clínicas de vacunación ubicadas en las escuelas de CPS o de instrucción pública, centros de salud, en la escuela y otros proveedores de atención médica que cuentan con un formulario de consentimiento firmando por padre o un tutor. A medida que se acercan las festividades, es importante recordar que las familias completamente vacunadas no necesitan máscaras, no necesitan distanciamiento social o restricción en el número de grupos si todos están vacunados, o hacer una prueba de COVID o hacer cuarentena cuando viajan a visitar a esas personas amadas durante estos tiempos. Podemos abrazarnos nuevamente y celebrar nuestras ricas tradiciones latinas sin las cuarentenas cuando viajamos, sin todas esas vicisitudes que nos ha presentado el COVID-19, si nos vacunamos completamente. Así que, por favor, familias, si no lo han hecho, reciban su vacunación. Es gratis, no ocupan identificación del gobierno, ni ocupan presentar ninguna información sensitiva para recibirla. Todo el mundo tiene derecho a recibirla, es un derecho básico a la salud. Gracias. Y ahora con ustedes, la doctora Maya Green. Please now welcome Dr. Maya Green, Chief Medical Officer, Howard Brown Health.
Thank you so much, Dr. Luna. I tried this before and I couldn't do it with a mask on. I just want to start by focusing on two things. Dr. Arwady, if you didn't hear it, said the majority of people that are hospitalized and having severe outcomes from COVID-19 are the African American community. Dr. Luna just said 33% of the Latin community have engaged in vaccinations, 30% of the white community have engaged in vaccinations, 19% African Americans engaging in vaccinations. Now, slide 21 that Dr. Arwady presented showed the rates of engagement in vaccinations. When you look at African Americans, there was a gap. So I want to talk to my African American community. So Pfizer COVID-19 vaccine has been approved for children 5 to 11. Now, a lot of us are thinking, hey, is this right for me? When I look at it, when I look at my family, the science outweighs the myths. The facts are the vaccine offers protection, not only for those who have not gotten COVID-19, but for people who have already gotten COVID-19, the immunity the vaccine offers is superior or better than the immunity, the weaker and short-lived immunity someone can get when they already have COVID-19. The other issue we're struggling with in that gap of slide 21, I keep looking like it's there, it's not there. In that gap is history of our communities being negatively impacted by the medical industry. So if you're of the African American community and you're thinking that I'm not here to gaslight you, those things happen. The updated information is that now in this day and age, there are providers of color that are changing the face of the healthcare industry by not only sitting at the table when the vaccine is being created, sitting at the table when the research is done, sitting at the table when the data is communicated to our communities, but we have healthcare providers, physicians, that are creating our own tables so that we can serve you in the manner that you deserve to be served. So if you're out there, connect with the provider, call the health department, ask for what you need, ask for a provider in your community so you can be connected to someone who is invested long-term, came up through your community, and is here to serve you. No matter what you think, there is now a doctor from your community here to help you and your family walk through this decision. Now, this isn't about politics. It's not about status. This is about giving your child every opportunity to thrive in this day and age, and that includes surviving this pandemic. I don't say that lightly. None of us want to be here. Let's be clear. None of us want to be in a pandemic trying to decide if the vaccine is right for us. That's why we encourage you to get connected with the provider you trust so that you can get the information. For me and my family, I know for our youth 5 to 11, the choice is to get that vaccine so they can enjoy the Kwanzaa, so they can enjoy Christmas, so they can enjoy the holiday celebrations, not only for their well-being, but for the future of my tribe. Our choice is to get the COVID-19 vaccine. Thank you.
That's okay, no worries.
I'm so sorry.
That's okay. Good afternoon, everyone, and I want to give a special thanks to the City of Chicago Department of Public Health, Dr. Arwady, Dr. Luna, Dr. Buchanan, for having me be part of this important conversation. My name is Dr. Juanita Mora. I'm an allergist immunologist here in Chicago, and I'm volunteer national medical spokesperson for the American Lung Association. I have been working nonstop throughout this pandemic, trying to help the most vulnerable communities navigate through these hard times. And because of it, I have found a lot of challenges, especially with the Latino community. And that's what we're coming here together to talk about. So last week, we launched the COVID-19 vaccine in kids ages 5 to 11. I honestly have to say that my heart filled with joy and hope, as being able to protect these kids is just so important. There are 28 million kids ages 5 to 11 years of age eligible for the vaccine. And let's face it, these little superheroes could get us to that much needed herd immunity. I have been having extensive conversations with parents as how to explain the COVID-19 vaccines and what it is to get them for their children. And so I tell them to reiterate the importance of getting the vaccine to protect them, and also to protect the people around them, maybe sick family members or more vulnerable actual members of society. It will also allow them to have their schools remain open, to have that birthday party with their friends that they've been wanting and asking all these parents for as well too. And it also will allow all of us to get back to life as we knew it. And this is the importance of vaccinating the kids and explaining it to them. And we know that kids are often reservoirs of COVID-19, and they are often served as vectors of transmission to other people. And this is the reason why it's so important to vaccinate them and protect them. Let me tell you, there are a lot of courageous and great kids that have been giving us all such a great lesson throughout this pandemic. I have vaccinated about 100 kids ages 5 to 11 in the last week in clinic. And I have been giving so many high fives, fist pumps, and I can tell you so many actual smiles that I saw in kids who said, "Yes, Dr. Mora, I'm finally vaccinated." And there's so many stories I can also tell you. There's a child who approached me and said, "Dr. Mora, I'm getting vaccinated for my grandma because she has cancer. I want to protect her." And then there's a mom that will always remain in my mind and my heart because she cried tears of happiness when her child got his first COVID-19 vaccine after this child was months on a respirator in the ICU, secondary to multi-inflammatory syndrome. And this is the reason why it's so important to vaccinate our kids. Many people think that kids don't get sick from COVID-19, but that is simply not true. Let me share with you some statistics. There have been 2 million kids ages 5 to 11 years of age that have tested positive for COVID-19. 8,033 of those kids have landed in the hospital, have been hospitalized, 1/3 of them in the ICU, and 172 children ages 5 to 11 that have died in this pandemic. I want that number, 172, to sink in to every parent who's watching us today. And I want to tell them, we can't afford to lose one more child to this pandemic. We have a vaccine that's 91% effective against COVID-19 and in protecting you, in protecting your family. Vaccines are safe. Vaccines are effective. Vaccines save lives. This is our time to rise up and vax up the kids because they're counting on us. We're the adults. And I want to encourage parents to also to talk to their pediatricians if they have questions, or their family doctors, and to go to trusted sources of information like the City of Chicago Department of Public Health website, or the CDC, or the American Lung Association at lung.org. We want to continue the conversation, and we want to save lives. We all want to get out of this pandemic. Now I'll say my remarks in Spanish. Buenas tardes a todos. Gracias al Departamento de Salud de la Ciudad de Chicago, a la doctora Arwady, al doctor Buchanan, a la doctora Luna, por invitarme a ser parte de una conversación tan importante. Yo soy la doctora Juanita Mora, alergóloga e inmunóloga y también portavoz nacional de la Asociación Americana del Pulmón. Y hoy vamos a hablar sobre la importancia de la vacunación de COVID-19, especialmente los niños de 5 a 11 años. Yo he estado trabajando toda esta pandemia bien duro para ayudar a navegar a tantas familias, especialmente en la comunidad latina, con tantas preguntas, con tanta devastación. Este es el momento de vacunar a nuestros niños de 5 a 11 años. En la última semana lanzamos la vacuna del COVID-19 en las edades de 5 a 11 años con mucha esperanza y con mucho corazón, ya que significa proteger a tanto niño. Tenemos 28 millones de niños de edad de 5 a 11 años que ahora son elegibles para la vacuna. Y este es el momento de vacunarlos. Muchos papás me preguntan, doctora, ¿cómo hablarle a los niños de las vacunas? Eso es lo que yo les digo. Las vacunas son efectivas. Explíquenle a los niños que las vacunas son importantes para protegerlos y también para proteger a las personas más vulnerables o enfermas en su propia familia. También es importante para que volvamos a la normalidad, esas fiestas con sus amiguitos, que vuelvan otra vez también a lo que son las reuniones familiares sin máscara, la foto con Santa Claus sin máscara también, y también a todos esos momentos felices y la vida como la conocíamos antes del COVID-19. Sabemos que los niños muy probablemente son albergues del virus, del COVID-19, y entonces fácil que ellos lo transmitan a otros. Por eso es que es tan importante el vacunarlos. Déjenme decirles que hay muchos niños bien valientes que se han estado vacunando en esta pandemia, de 5 a 11 añitos. La última semana yo vacuné 100 niños en la clínica. Y tanta emoción y tanto júbilo que vi en los niños. Niños que me daban palmitas, niños que decían chócalas, que me decían gracias, doctora, que me vacunaron. Un niño también me dijo, doctora, gracias por vacunarme, me estoy vacunando porque mi abuelita tiene cáncer y es para protegerla. También otra mamá que lloró y lloró después de ver a su niño recibir la primera vacuna del COVID-19. La razón por la que lloró fue porque su niño había estado en un respirador por meses debido a infección multiinflamatoria, del síndrome multiinflamatorio debido al COVID-19. Esta mamá tenía su corazón lleno de felicidad al ver a su niño vacunado. Por eso es que es tan importante el proteger a nuestros niños y vacunarlos. Mucha gente piensa que los niños no se enferman por medio de COVID-19, pero dejen darles algunas estadísticas. Tenemos 2 millones de niños que se han infectado entre las edades de 5 a 11 años durante esta pandemia. Y de esos, 8,033 han sido hospitalizados, con 1/3 de ellos en cuidados intensivos. Y de esos niños, 172 niños entre edad de 5 a 11 años han muerto. Ni un niño más queremos que muera en esta pandemia. Es tiempo de salvar vidas. Es tiempo de vacunarlos para protegerlos. Asimismo, animo a todos los papás a que se vacunen. Únete y vacunen a sus niños para protegerlos y en familia, para que podamos disfrutar estas Navidades, las posadas, etc. También les digo con todo el corazón que vayan al sitio de internet si tienen alguna pregunta de la ciudad de Chicago, de la Asociación Americana del Pulmón, del CDC, y que también pueden hablar con su pediatra o con su doctor médico si tienen algunas preguntas. Pero vamos a proteger a nuestros chiquitos ya que ellos son el futuro. Gracias. And this is Dr. Smith.
Last.
But not least.
Well, good afternoon, everyone. I think my remarks are almost superfluous, but I want to focus in on a couple of things that were said by Dr. Mora and also Dr. Green. I'm an African American of over 70 years. I've been in healthcare for over 45 years. Also pastor a church of thousands of parishioners. And I understand on some level in our community hesitancy about vaccines. So if my voice is trusted, I'm speaking directly now to communities of color. You've heard the statistics already. We bear the brunt of every negative pandemic, economic, and racial in this country. And we have a history of not trusting certain institutions. I get that. But let me assure you that there are African Americans of note, academic, medical, and other, who have been in the front lines since COVID began. I remember the first few months talking to friends of mine in the NIH and other national healthcare institutions. And we talked about the people that were in the front lines, many of them that look like us, that were in the forefront of vaccine development. You heard what Dr. Green said, that the past history of mistrust is real, but it does not in any way reflect this pandemic. Both from historically black colleges, to physicians, to the NMA, which is an African American, mainly medical organization, they've been independent in the forefront, making sure that both the equity of not only the vaccine development, but resources get to the communities of color. But yet you saw the statistics. We lag behind, not only in the epidemic in transmission, but so painfully in mortality. I remember the first 3 months of the pandemic, and on the news they talked about why is it that communities of color are dying faster. We should not have been surprised. We have very few resources, and oftentimes the mistrust further complicates what we must do. So I urge my fellow African American communities, I urge the leaders of those communities, please get behind these vaccines. They are safe. Billions of people on this planet have received at least one dose of a very effective vaccine. Not only are they safe, they are effective. You heard the numbers. In the 90-some percentile, if you are fully vaccinated, your chance of dying from COVID is almost zero. These are facts. These are facts that we must pay attention to. I am a 41-year person on staff at the former Children's Hospital in Chicago, now and in Robert Lurie Hospital. I care for children with dread disease, sickle cell disease, cancer, other things that compromise your immune system. I have seen some of them die, what I believe needlessly, because we are not vaccinated. I will tell you again that the vaccines are effective and they are safe. Our children are our most precious commodity. Ages 5 to 11, you heard what was said about the statistics. Almost 200 pediatric cases have died in this country alone, not counting the world, from COVID-19. The multi-system diseases that affect almost only children is a dread syndrome where organ systems shut down. It does not have to be. We have now at our fingertips not only curative measures or treatment measures, but preventative measures. I think that's so important to understand. Don't wait for your child to get sick. Don't wait for your child to be a carrier of a disease that may be very mild in them, but will affect adults, grandparents, and others. We're about to approach the high holiday season. I'm also a pastor. In our church, I will tell you that we have over 92% of all parishioners who have been vaccinated. Why is that, Dr. Smith? Because I urged my congregation at the very beginning to be involved in the vaccine research studies. Let me be very transparent. I did not want what I knew was going to happen. I knew a vaccine had to be developed. I did not want one to be on the scene that was not tested in people that look like me, because the risk of not being effective is too high. So our parishioners got behind the Moderna and the Pfizer studies. And that's why, again, we have more freedom in our church, because we understand the science. Again, I urge you, our children are so precious. I've seen children on respirators. I've seen them succumb to disease. I've seen the parents who could not visit, the grandparents and others. One is too many. I urge every African-American leader, every trusted voice, urge the people that you affect to get vaccinated. If you're not sure about it, call someone who looks like you, who has been trained and understand the risks and the benefits. I understand, again, hesitancy. But now, as Dr. Arwady said, the time is urgent. The longer you wait, the higher your risk of another mutated virus to affect our community. We talk about this variant, the Delta variant. It will not be the last one in communities that have not been vaccinated. That's where the virus resides, and it's able to mutate. And that mutation usually makes it much less available to the vaccines. So again, to all of my brothers and sisters, I urge you, I implore you, I beg you, protect our children, protect our adults, protect our community. Let's make Chicago and the world safe by being examples of what we must do, and let's end this pandemic.
We'll take some questions now. I have the mic here.
Thank you so much to all of you.
This is for Dr. Arwady. New York City's already doing it. Do you suggest anybody over 18 get the booster?
So, as you've heard me saying really fairly loudly over these last few weeks, my biggest priority always is people who have not yet had their first and second dose. My second priority is anybody over the age of 65 and anybody over 50 with an underlying condition. No questions asked. I want you to get that vaccine. Also, anybody who got Johnson & Johnson, the one dose, 2 months later, we want everybody to get a second dose. Beyond that, I am encouraging people who believe that they are at risk from COVID to be getting that COVID booster. So definitely anybody who's working in a setting that they're concerned about, living in a setting that they're concerned about, gathering regularly with a group that they're worried about, I would encourage people to get that booster vaccine. We've not formally gone out and said you must get it if you are over the age of 18, but we are not turning folks away when they are coming looking for a vaccine, as long as it's 2 months post J&J or 6 months post either Moderna or Pfizer. We are seeing families in some cases, now that there are some more children being diagnosed with COVID, and often where parents are boosted, they're less likely to get a breakthrough infection. The most important thing, though, first and second doses, and that's where our focus really continues to lie.
Actually, this is for CEO Martinez. Can you address the sub shortage within CPS?
Yeah, so this has been a nationwide challenge for districts across the country. I'm involved in multiple national organizations, so we have definitely seen it at CPS. We have, and we actually, the good news is we have less vacancies than we've had in the past. So on a 20,000 base of teachers, we have about 600, a little over 600 vacancies. So that has really helped us. But even with that, we've been getting about 70% of our either absenteeism or just individual on leaves with getting coverage with substitutes, and that's probably one of the lowest we've seen. And so we continue to increase the pay rates, and we're seeing an uptick in that, or we're seeing some better improvement with that. But it is a national issue. It is something, as I think about next year, that I'm already looking at how do we plan for next year and starting to expect it, because I think it's a perfect storm of COVID and a perfect storm of a very tight labor market.
All right, Dr. Martinez, hi. Amy Jacobson here. Any progress on test to stay, and how many CPS students are in quarantine right now as we speak?
So we have still over 4,000 children in quarantine. Again, we've seen some uptick in cases. By the way, the ratio, the reason we were pushing so much for 5 to 11, the ratio of quarantine between elementary and high school children is about 14 or 15 to 1. So for every high school student we quarantine, we're quarantining 14 to 15 elementary children. We are going to start the pilot for test to stay on the week of November 29th. So that, and then we're going to scale that up. And what I've told the team is this is the long game. So we're going to be scaling it up throughout the end of the year, because I expect that we're going to have this pandemic through the end of the school year.
Okay, Dr. Arwady, a few questions for you. First of all, thank you for this data. We just don't get this information at the state level, so a lot of people appreciate that. You mentioned that's 250 CPS kids that are newly diagnosed with COVID. Are any of them hospitalized? Are they mostly asymptomatic? Do we know?
Yeah, so we've continued to see, thankfully, very low rates of hospitalization. We are averaging fewer than 1. It's about 0.3 hospitalizations every day in children in Chicago. So it is rare, thank goodness, to see children hospitalized, but it can happen. And my worry is that, of course, as cases go up, you have the potential to see some more hospitalizations.
Okay, and do we know about the student-to-teacher transmission rate? Is there even one? I mean, New York Public Schools, it's 0.0637. Yeah.
So I shared actually on my Facebook Live this morning some more details about what CPS and what we've been investigating. Across all of Chicago Public Schools, since school reopened in late August, there have been 33 instances where we couldn't rule out in-school transmission. The largest grouping of that was 5 cases. Most of them, in fact, are 2 cases. In most cases, they are student to student. We've also seen some staff to staff. We've had just a handful where we think there was potentially transmission between student and staff. But for the size of the district, very low, and certainly nothing that's raised concern or suggested larger outbreaks.
Okay, and lastly, I'm sure you see what's going on in Austria. They're locking down people 12 and older who are not vaccinated. Arne Duncan, the former CEO of CPS, said Austria is onto something in one of his tweets. Can you respond to that? Would that happen here?
So I feel like I should respond in German. I don't know. So basically, for those who aren't aware, Austria is in the middle of the worst COVID surge that they have had to date. Eastern Europe, in particular, is where this started, where there are very low vaccination rates. And then we've seen sort of Germany, Austria, Greece increasing there. It is winter. This is continued to land largely on the unvaccinated. If you actually look at the details of what Austria is doing, it's not quite as dramatic as it perhaps sounds. What they've said is that for people who are unvaccinated, they can only leave home for essential activities, which includes getting food, getting medical care, or going to work or school. So really, it's not about I have to completely lock down, but they're trying to not really allow people who are unvaccinated into more of the fun activities. We'll see. I think there are some real questions about, how are you enforcing that? How are you following up on that? Certainly, as you know here, we have mostly been prioritizing vaccination through employers, which has been going well overall. We've also seen a lot of businesses step up, and every time I've had the great fortune to get to go to the theater a number of times over these past few weeks. They're all requiring vaccination or proof of a negative test recently. We think that is the way to go. want to do everything we possibly can to not have to get into lockdown type situations. I don't anticipate it happening because of the vaccine, unless a new variant emerges and the vaccines don't work. But what we've been able to see is here in Chicago, with continued focus on building vaccine confidence and not just going with the average, but really saying, let's keep putting resources into community areas that are less vaccinated. That's where we're likely to see COVID really take off. We think of the whole city together. So I don't see us, trying to have one part of the city or one portion of the city vaccinated status or not having a different status than someone else here in Chicago. The reason we're pushing vaccine is I want to do everything we can to try to stay open. If we did need to pull back on anything, we would do that across the city. But vaccination, and doing anything that promotes confidence in it really is the end game here.
Doctor, back in May, the CDC said those that were fully vaccinated can forego masks in public settings. Next week, DC is getting basically rid of their mask mandate except for certain restrictions. What about that here? We're one of the last states.
Yeah, so couple things on this. So one thing that happened, as everybody will recall, in that sort of May, June, July period was we had the emergence of the Delta variant. And really, with the emergence of the Delta variant, we saw so much more ability for this virus to spread among folks who are unvaccinated, but we also started seeing breakthroughs, frankly, in folks that were vaccinated. And so although the vaccine remains wonderfully protective, it's not 100%. And at a time where we were seeing such surges, our goal is to stay open and to stay safe. And the masks are a part of that. What I'll say is we've been talking with the state quite a bit about this. As you know, if and when we can get back down under that 200 case per day mark, the mask would come off. No question about it. That is the threshold that the CDC has set, and we've been sticking to it. While we are on the increase, it is a time I am worried about pulling back on masks, for example. Michigan and Minnesota, I don't know if people caught that, rates of 70 per 100,000 per day. We're sitting at just over 15 right now, so 5 times the rate of COVID. That is not where I want us to go. And I know people are tired of masks. They're not going to be here forever, but if they are the difference between us being able to stay open and to, frankly, continue to save lives, particularly as we're working on getting these 5 to 11-year-olds done, I think that's going to be a primary focus. I've been talking with the state about, particularly once the 5 to 11-year-olds have really had that opportunity, particularly fully vaccinated settings, whether we could think about dropping masks in those requirements. I'd be comfortable with that, but it's thinking about what are the logistics of that. And again, when we're on an increase, the number one rule of epidemiology is to respect the curve. When the curve is going up, it's likely to continue to increase, and it's not the best moment to pull back on restrictions.
Is there talk of perhaps getting rid of masks for schools in the new year?
We'll see. As you know, the CDC really has recommended universal masking in schools. Most of that was because vaccine was not available. Where I'm thinking about high vaccination rates, for example, in school, yes, that is absolutely something that I would be interested in. We see a lot of variability in vaccination rates, even here in Chicago, and certainly a lot of our focus is on bringing those vaccination rates up. I'm not going to get ahead of the data and the science and the CDC on this, but we know that people are looking forward to taking those masks off. I want to be in a place to take those masks off, and highly vaccinated settings are going to be the safest settings to do that in.
And then could I just ask Mr. CEO Martinez, can you clarify on the substitutes? So I just want to make sure I understand it, that right now CPS has about 70%, maybe 70% coverage when there's a sub, and what are you paying now? And how does that compare to other places?
Yeah, so we've increased sub rates by 30 to 50%, and we have a variance because, for example, we actually are paying more when substitutes continue to be in the assignment for multiple days, because most of these individuals are day-to-day subs. We've also set up an agreement with the CTU to actually put aside $10 million specifically for what they call cadre subs. These are substitutes that come every day for that same assignment, but they also have health insurance benefits. So we're really, pulling out all the stops. So at 70%, again, it's not ideal. What it does is it requires us to leverage our school staff. So whether we have academic coaches, sometimes our assistant principals and principals will teach a course. We are also sending central office staff. But like I said, this has been an issue that I have seen across the country. Every large district that I've talked to is having similar issues. And the good news is that this is forcing all of us to really respect their substitutes a lot more and to actually pay them more, because substitutes have historically just received such low compensation rates. And so I actually think this is something that's good for the long term.
Dr. Martinez, you can stay there. My first question is that you said last week that you were going to target the areas where you did not see a lot of vaccinations happening. Can you tell us what specifically are you going to do in those areas, and are there areas that you guys already know that you need to target?
Yes, we know historically in many of our communities, especially in our Black communities as well as our Latinx communities, there's certain areas that we always have had lower vaccination rates. By the way, it's not because we don't have presence there. We have our regional sites, we have our school-based clinics, we have our mobile clinics, but even with that, we don't see individuals coming. In fact, this Friday, we had a great turnout across all of our 4 regional centers. We had good turnouts with our mobile sites. We're still getting our data from our school-based clinics. But even in every one of those sites, we always had supply. We never had to turn anybody away, and we were accepting walk-ins. So for me, that tells me, and Dr. Arwady has said this, just having events across the district by itself is not going to work. So what we're going to be doing is going neighbor by neighborhood. So for example, in the Little Village community, Mount Sinai was an example where they said, we'd like to put some events together with you at some of your schools because we have a trust with the community. We can provide the information. That's what I'm going to be looking for across the different neighborhoods. So whether it's North Lawndale, whether it's Garfield, whether it's Roseland, so across those neighborhoods where we've seen sometimes historically lower vaccination rates, and now because 5 to 11-year-olds are part of it, it could be the whole family. So even though we really push hard for 5 to 11-year-olds, we also saw 12-year-olds end up getting vaccinated. We even saw some adults getting vaccinated and getting their boosters at our site. So for us, we want to just really target the families now. And so we're going to be getting the data through Dr. Arwady, and we have a great partnership. We're going to get the data school by school. We're going to be providing a lot of information through our principals, through our teachers. And like I said, we're playing the long game. This is going to be for the entire school year.
My other question is, how are you going to ensure that the people who got their first doses over the last couple of days actually get the second dose? Because we've seen some variability in that.
That's a great question. So the good news is, again, we'll get granular data by school, and so then we're actually going to offer to families, anybody who needs assistance with their second shot, on how to leverage both our partners and our resources as well. And then we'll just monitor. So in other words, as we get to, and the good news is, even though when the vaccines first came out, I always thought it had to be exactly by the third week, right, and exactly on that same day. In fact, that's how they would do the appointments. We know we have a little bit of flexibility. We want to keep it as close as possible as the 3 weeks, but we want to work with families. So if they got their vaccine shot on Friday, we could probably get them help them that 3 weeks later that Friday, or even on that Saturday or that Sunday. So those are the things that we're going to be working with families. And the good news, like I said, we're going to use data to drive that that kind of strategy.
So will things like the mobile units be back at the schools that they were at 3 weeks later, or things like that?
If families need that help. And so that's why we want to reach out to the families and see who actually needs help. Because like I said, just being present by itself doesn't do it. So we actually have to have conversations with the families and ask, if you need help, we can set up a vaccination site, a mobile site right there at that school.
Hi. Too short and too long. For Dr. Arwady, please. There's a ring around Hyde Park, and it's the neighborhoods that have been there for a while, Washington Park, Woodlawn, and Greater Grand Crossing, that have seen disproportionately low vaccination rates. Is the city doing anything in these neighborhoods specifically to try to get those rates up? Yeah,
of course. So those neighborhoods are included, in our current iteration of Protect Chicago Plus and, Protect Chicago 77. And just to add kind of a little more detail, just to give you a flavor of some of what we're doing. As you know, We've done the door-to-door. We've done the bringing the bus. We've done the come to the housing centers. We've done the senior outreach. And one of the most recent things that we've been doing is actually having our call center. We have folks there 7 days a week. When people call 312-746-4835, they're taking incoming calls, scheduling people for appointments. But we've also been using that cadre of people to do outgoing calls in a very focused way. So
how's it focused?
So it's focused, sometimes it's focused geographically. We've actually done some work with focus on schools. So we looked at some of the schools that had the lowest vaccination rates for 12 to 17-year-olds, and working with CPS, called those families individually, basically, and worked to try to get people signed up for at home or signed up for an appointment. It is not access as much as it is these trusted conversations at this point, honestly. And so I think, we continue to really work and support the community partners who are doing the amazing work on the ground every day. As you've seen, a lot of the best progress we're making in vaccination is in the areas where we most need to make that progress, which I'm glad about. But we still have a long way to go. And if people have additional ideas, we're all ears. We've been doing a lot of, I think, creative things. We certainly have not dropped our focus on the areas that have the least vaccination, and it's where we continue to put the most resources.
I want to return to that in a second, but I noticed in the data that vaccination rates for Chicagoans aged 65 and older are no longer at a drop compared to the former cohorts. For a long time, they were a couple of percentage points behind the people, I think, 55 to 65. How did you guys increase that rate?
So we've had a lot of focus on seniors, actually, recently. So in the same way that we did the calling for the schools, we actually did some work to see who were the most vulnerable Chicagoans who had Medicaid, for example, who were dependent on electricity for medical needs, whether that's for diabetes or electric wheelchairs, et cetera. And in the same kind of way, actually did calling to those folks and specifically prioritizing them for, in most cases, at-home vaccination. We also have been running a senior campaign. So, Wheel of Fortune, all of these places, we've been running advertisements, and they are Chicagoans, older Chicagoans, telling their stories about why they decided to get vaccinated, often how they were hesitant at the beginning and how others are doing it. We've also been working with AARP and some others. We've done mailers, recognizing that the old school postal mail is a good way sometimes to reach older Chicagoans. And we've seen people, honestly, with the grandkids too, with the grandkids now able to get vaccinated, we've seen a lot of those kids, I love it, being like getting grandma to come along too. And there's nothing I would rather see than a grandparent get vaccinated with their grandchild. It's been a wonderful story to see over these last few weeks. So kids out there, keep it up on the grandparents.
Frankly, that sounds like a story, so thanks for the idea. The longer questions now. This is honestly, I just read a piece in the LA Times about this. And if Doctors Smith or Green want to address it as well, no, stay up there, please. How is the city? Please, can you talk about how the city's reaching out to people of color, especially people without primary care physicians, people who are working during the business hours during which a lot of pharmacies and clinical sites are giving out the vaccines? The Times reported that public health workers are noting that men of color specifically especially are uncomfortable with traditional health care or governmental settings because of how they're perceived, be it for their tattoos or for because they used to be incarcerated. And then the article also talks about how information and misinformation is spreading from families and friends. I also want to point out LA County has a better vaccination rate both for Latinos and for Black people than Chicago does at this point. I don't know if there's anything to be learned from our peers on the West Coast.
So, okay, a lot in there. I would say the bottom line is that we are trying and have been trying all along to use trust where it exists in communities, really looking to support community-based organizations, community-based providers. We've used a lot of non-traditional partners and really continue to double down on that. I think it's not always what people expect. For example, our at-home program, the majority of those doses, week after week after week, are taken by Black Chicagoans on the South Side. And where we see programs have particular uptake in the spaces where we most want that uptake, that's where we double down. That's where we put additional resources. So we've been adding more capacity, particularly, south and west sides. I really, honestly, I would say that there's not barriers in terms of getting the vaccine at this point. The health department, for example, every Saturday, every Sunday, we're standing up at city colleges, sites that are very known to communities. And we are doing, 1 and then 3 weeks later back again. A lot of our partners have been focused on weekend and evening hours. With kids, that's especially important because, you'd prefer them not to miss school ideally if they're needing to get second doses, et cetera. And so, I don't have a magic answer there. California is a very vaccinated state overall. And this has been a major focus and remains a major focus.
Anything you guys want to add?
Thank you. I think Dr. Arwady mentioned trust, and when we think about what we have to do for communities that have experienced a lack of trustworthiness of the medical industry, is we have to contact their leaders. That's why we contact ministers, club promoters, whoever is the leader of their tribe. We have to recognize that no matter how far we are away from our ancestry, we still move in tribes. And so saying something in a language that we think everybody should understand does not address and protect the tribe, So, and then the other thing I've gotten some advantage from is being authentic, just plain being authentic. No dress up, no, without the sats, and being that person that somebody can call and say, hey, I'm nervous about the vaccine. I can't tell you the amount of Black men and Black women I have stood there and held their hand while they get the vaccine. And that is important because now that person knows it's not just a press conference or anything, but I'm here for you after the campaign. After this first rolls out, months later, I'm still here and I'm still with you, of you, and here for you. So,
yeah, I would echo what Dr. Green said. Our church, early in the pandemic, was a vaccine site. We vaccinated thousands of people, almost all African Americans. In the last 6 weeks, every Sunday before service and after, Walgreens is there with the booster, with influenza vaccine. Again, we talk about trust, but to understand trust, there has to be trust before the acute event. So it's no surprise to us if you look at where African Americans congregate, who they trust, their leaders, their ministers, and so forth. And city's done a pretty good job in trying to make sure that those individuals are brought into the fold and become spokespersons and make the access at a place they're familiar with. It's hard sometimes for the majority to understand that. Dr. Green said it. Look, the word tribe means that we respect and understand our culture. It's not a slight against anybody else. But if you want to get Black people, if you want to get African American men to be vaccinated, you better put your resources where they are trusted already. If you come as a spokesperson, they're not going to believe you. You're going to have to make sure, whether it's a church or a mosque or a synagogue or whatever, where people are used to coming and they know those leaders because they trust them. I said this to the governor and to others at the very beginning. Healthcare has always been a trust issue. You can live next door to University of Chicago or Northwestern, but you don't trust them, you're not going there until end-stage disease. That should not surprise us. We're going to have a long-term strategy for communities of color. We're going to have to not only jump in when there's a pandemic, but we're going to have to make a commitment long-term because people are fooled all the time. They're told something in an emergency, but the follow-through is not there. So I would urge all of us that have any influence to understand that. The cultural aspect of this pandemic is no different than with HIV and AIDS. Why is it right now that 75% of the new HIV and AIDS cases are in these communities? These things exist now. So everybody else is up in arms about COVID. We should be, but unless you make a long-term commitment that people can measure, then you will not build trust and you will not get those numbers. You're going to have to do that.
Thanks, everybody.
Yeah.
Can I go back to my space? But the other reason why, when you look at Dr. Smith, and if I can say this, one of the reasons why that's so possible is when we think about the essential workers. Remember, there was like, this is available to essential workers. They are the pastors. They are the doctors, yes, but they are the pastors, because you have, and the other club promoters, the other community leaders, because you have to vaccinate them first so they can live to tell the rest of the people that look up to them about it. And I'm gonna keep it short, but Dr. Smith, one of the reasons why they were essential is not because they're a doctor, and I respect that and everything, because it took a lot to get there, but because they were caring spiritually for the community long before. And that was the buy-in that came, not because of the doctor and the MD and stuff like that. It's because of the spiritual leadership.
Thank you.
Sorry. Sorry.